You're watching Con TV 616. From around the Northwest and beyond, this is Seattle Live.
For a lot of kids, the flu and cold season also means an increase in asthma attacks. With me today is Dr. Richard Molteni of Children's Hospital here in Seattle. Thanks very much for joining us.
Good morning.
And he says even though there's a flu vaccine shortage, there are some other ways, some other steps you can take to lower the risk of asthma attacks in kids. Thanks very much for bringing this to our attention and helping us out a little bit on this. First of all, describe what actually happens to a child, to somebody who's very young, during a serious asthma attack.
Well, during an asthma attack, the air tubes that we breathe through have strong muscles that surround them, and either an allergen or a viral particle causes those to constrict and narrow that airway significantly.
So obviously very dangerous.
Very dangerous, and that airway also, the lining, can also produce a significant amount of fluid and swelling to even further narrow that airway, and that produces the common symptoms of difficulty breathing, wheezing, and cough.
Now, we've been hearing a lot about flu and talking about a lot about flu as we introduced you this morning. How does the flu and asthma intersect? What are the dangers? Why do we see more of it in kids who may be prone to asthma? Or why do you see more asthma in kids who are having the flu?
Right. Well, particularly in the younger child, you look at what triggers these attacks. It's viral illnesses, of which influenza is one of many that kids get. And they get together in the winter, they're closed in schools, they're closed in houses, and so the risk of passing viruses back and forth and triggering those attacks is much higher.
Now, some of the things that we all face fairly commonly, or might face fairly commonly, can be triggers for asthma. Let's talk a little bit about this. Here's a list for you. Some of the infections, some of the animals, some of the exercise situations. Bing these off for us very quickly.
You bet. Infections we talked about. Young children in particular, viral illnesses. Animals in the home, dogs, cats, long-haired, small pets, the dander, even the saliva is allergy producing. Many kids who go outside and exercise, in particular cold air, can trigger an attack in those children. And in some, just emotional stress in the home, in school, at sports events can produce that same reaction.
And the last three really look sort of like common sense. Cigarette smoke, mold, dust, obviously avoid those if you can. A few other basic tips on preventing or reducing those asthma attacks, especially for kids.
Well, concentrate on the child's room.
Right.
Keep dogs out. Don't smoke in the house. Most importantly, keep the room clean. So also use HEPA, or high energy particle filters, in their rooms. Cover their mattresses, cover their box springs, cover their pillows with protective covering so they're not breathing in those allergens. Keep things such as toys and long-haired toys in their room out of their room. Anything that would hold on to an allergen.
Be aware
particle.
of it and take steps.
That's right.
All
Keep
right.
the room clean. That's
Thank
the
you very
key.
much, Doctor. Appreciate your help today. If you want more help, you can always look for more information on asthma in kids. You'll find a few very helpful links on kongtv.com.